Hi, I'm Dan Rubin, board-certified naturopathic oncologist, back at you for 2017's last episode of Ad Hoc with the Doc. Thought it would be great to talk about some of the medical achievements that have happened in the world of naturopathic and integrative medicine in 2017. There's been just quite a lot going on. Of course, my specialty field is naturopathic oncology, and I followed closely along with a lot of the events that have happened. But a lot of the modalities we offer here at Naturopathic Specialists, like women's health, pain management, IV therapy, nutritional and diet counseling, exercise, weight loss, there's been advances there too. If you've been following either Facebook feeds or Instagram feeds or other websites or whatever mail lists you're subscribed to, you probably have seen quite a bit of advancements, especially this year. Seems to have accelerated those advancements over other years. But as more and more physicians and medical centers or institutions are recognizing the true value of what the human being requires, good water, sunshine, plenty of movement, the right type of food, stress reduction, the right type of nutrients and supplementation for whether it be an active lifestyle or stressful lifestyle, you're seeing that more and more studies are demonstrating the effects of the naturopathic type approach instead of just purely the medical or surgical approach. And I want to talk a little bit about those today because that's what we offer here at Naturopathic Specialists. We are an 8-physician team of naturopathic doctors, and we all have, many of us have different foci. And I'd like to talk to you about what we offer here at Naturopathic Specialists and what you may have seen in the news. So to lead off, of course, because I'm involved for the last 20 years in naturopathic oncology and being a board-certified naturopathic oncologist, I'm laser focused on what's going on in the world of oncology. So one thing that has really come into play is mistletoe therapy. We've received a lot of comments and questions about mistletoe therapy from providers and our patients alike. Some people are bringing in information asking us about the appropriateness of mistletoe therapy. What's interesting is that mistletoe, it's a plant, and it is the most well-researched botanical agent in oncology out there in the world today, as far as I know. We had used mistletoe therapy for years at our clinic here, but the FDA had taken that treatment away from us. But we've recently received a new approved form, and we're now back using it. And what's interesting too is that it's in the news. It's being shown to be effective in clinical trials. In fact, one of the newest types of successful treatments in the world of oncology, something that's been in the news now for the last couple years, but in 2017 continues to grow in its usage, are immune therapy regulators called checkpoint inhibitors. And checkpoint inhibition is a field of oncology that's relatively new. It's certainly a type of oncology and immune system therapy that we know and have co-managed alongside in an integrative oncology format. And mistletoe therapy has been shown to help the effectiveness of those treatments. If you're interested, please, if you think it's appropriate for you want to know if it's appropriate for you, please call our front desk and certainly schedule an appointment or talk to one of your physicians here at NS. Further, many symptoms are associated with the use of conventional treatments such as chemotherapy, biological agents, radiation therapy, or even post-surgery. And one of the main complaints that we see here is fatigue. Fatigue can be an ambiguous complaint, ambiguous from the perspective of what is causing the fatigue. But it's also one of the commonest complaints that we see. And what's interesting in the world of oncology therapy is that mistletoe has been shown to be effective to combat fatigue. So it's really, really a big happening. Mistletoe is used worldwide, and it's certainly for use here in the United States. Another very interesting and exciting happening is that the Journal of the National Cancer Institute released a statement defining integrative oncology. As naturopathic doctors, we participate in the field of integrative oncology. It's certainly not all that we practice, because we certainly practice naturopathic oncology too, but there is a distinction here, and I'm going to tell you the definition because I think it's important. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. Now, one of the key words there is empower. We have always sought to empower our patients. At Naturopathic Specialists, we strongly believe in educating people. It's one fantastic form of empowerment. We explain things to you. We really believe that an educated patient is the empowered or stronger patient. And when you understand whether it's your diagnosis or understand fully the treatments that you're going to be going through, whether it be from the conventional side or from the naturopathic side, it always helps to prepare people and help people deal with the treatments. So, love the definition of integrative oncology. I mentioned a distinction. Some people, although they may be seeing their conventional physician, are not necessarily being treated by their conventional physician. And so there's a co-management aspect to that, and sometimes naturopathic oncology is the only type of treatment that they're able to undergo for whatever reason. If you have any questions about that or the distinction, please talk to one of the naturopathic oncologists and naturopathic specialists. We have 3 board-certified naturopathic oncologists here. We have myself, Dan Rubin, we have Dr. Melissa Coates, and we also have Dr. Lisa Alschuler. And our new resident, Dr. Adam Kozin, is about 2 years away from being eligible to take his test. But please ask us about any questions you have about the difference between naturopathic and integrative oncology, or how the two join together. This month, actually, there was a recent article on clinicaloncology.com detailing how naturopathic doctors are becoming an integral part of the patient care teams. And what this is highlighted is 2 doctors here, 2 naturopathic oncologists are interviewed. One of them is Michelle Neasley, the other is Heather Wright. Dr. Heather Wright is the current president of the Oncology Association of Naturopathic Physicians, and it highlights especially how naturopathic doctors have been invited to become parts of tumor boards for certain institutions across the United States. And basically what that means is that naturopathic oncologists have been invited into the discussion about certain difficult cases that may be presented at the tumor boards. It's a very important happening. Very proud of the physicians who are engaged in that. Also, another happening is that the Oncology Association of Naturopathic Physicians launched their KNOW database, KNOW, which stands for Knowledge in Naturopathic Oncology website. Naturopathic Specialists is one of the initial and very proud sponsors of that effort. Again, we believe that knowledge is power, and we believe in being educated and informed. We believe in evidence-based medicine, and KNOW is a very powerful engine to help us quickly search and obtain data that we know. So that was launched this year. Furthermore, let's talk about pain management, because as you know, if you've been watching the news or your feeds, the opioid crisis in America has really risen to an alarming rate. We know that there's been a public health emergency alerted, and we've participated in helping educate people about some of the choices that they may have related to opioids. We recently interviewed Dr. Gina Berman on Ad Hoc with the Doc. Dr. Berman and I talked about the use of opioids and some of the alternatives that people can use, especially in the world of cannabinoids. That would be relevant, of course, if the state you're living in has a medical marijuana law. But the issue is that naturopathic medicine has been shown to be proven alternatives to opioids. Opioid use, as we know in America, is at an alarming rate, and people are becoming addicted, and people are dying from the opioids and from the overdosage, and it's a serious thing. Here at Naturopathic Specialists, we have alternatives. Dr. Amy Wade is here, who heads up our pain management department. It's actually been shown and proven that in place or instead of these addictive drugs, naturopathic medicine has been found to treat chronic pain. There was an article published on naturopathic.org. It was a press release that demonstrated this. There was a new FAQ promoted by the American Association of Naturopathic Physicians, I believe in response to the opioid crisis, demonstrating the effect that naturopathic medicine can have, and just knowledge out there that there is this option. So if you know a loved one who is not doing well on opioids, or who needs some other form of pain management, or is worried about becoming addicted, give us a call here. We can have you talk to Dr. Waite, set up an appointment with you, and talk this through. Furthermore, acupuncture has been found to alleviate joint pain caused by aromatase inhibitors. Now, this article sort of splits between oncology and pain management. One of the side effects associated with these anti-estrogen drugs called aromatase inhibitors is joint pain. Here at Naturopathic Specialists, we see many women on these drugs who have quality of life issues, especially related to joint pains. Joint pains is a known and frequent side effect of these drugs. Acupuncture is certainly one of the modalities we use. We use a lot of lifestyle modification. We do use supplementation. We basically use what works, because we believe that when somebody has cancer or they're thriving and surviving breast cancer, that activity plays a big part in their survivability and prevention of recurrence of disease. Part of being active means that you don't want your joints to hurt. So give us a call if you know somebody or you yourself has joint pain from aromatase inhibitors. Interestingly enough, too, that the American Family Physician Practitioner Guidelines in 2017 added certain non-conventional or integrative therapies to their list for chronic pain, including heat, massage, and acupuncture as first-line therapies. That's important, because instead of just a script for a pain medication or an anti-inflammatory, starting to look more functionally at body work. We offer massage therapy here. We have a wonderful massage therapist here. Andrea Autry is here, offers multiple types of massage therapy. Massage therapy, as you know, works on the soft tissues, and oftentimes joint pains or pains that you may think are not associated with soft tissues may actually be associated with soft tissues. Massage and or acupuncture can be a wonderful first-line therapy. Dr. Amy Waite has brought a prolotherapy program to naturopathic specialists, and a systematic review published this year, it was this summer in June, in the British Medical Bulletin, demonstrated that prolotherapy significantly decreased pain and improved function and range of motion in the short term and long term for people with knee osteoarthritis. It's a huge and common complaint, osteoarthritis of the knee. And just to think that prolotherapy may actually save some people from a knee replacement. If you know somebody that has chronic knee pain and maybe oral meds aren't working, or somebody doesn't want to go on oral medications, or is looking to perhaps save themselves from a surgical procedure, give us a call. Come see Dr. Waite. She's excellent at providing prolotherapy. Lastly, in the world of pain, a meta-analysis showed that a treatment called platelet-rich plasma therapy was found to be effective in the treatment of tendinopathy. Tendinopathy is an inflammation or an abnormal condition of the tendons. Tendons, we all know tendons. Tendons attach muscles to bones. That's what they do. And we need that tendinous attachment. So things like tennis elbow or golfer's elbow or pitcher's arm, these oftentimes are tendinopathies. Sometimes, of course, they could be ligamentopathies, but if somebody you know has sore muscles at attachment sites in the bone, this could be a true tendinopathy. And platelet-rich plasma therapy, which we do here at Naturopathic Specialists, could be a very effective and rapid relief type therapy. Give us a call if you have any further questions. IV therapy is something that we offer at Naturopathic Specialists, whether it be nutritional or some other form. Interestingly enough, getting back to the naturopathic oncology world, IV vitamin C therapy was shown to sensitize certain types of cancer cells. And those are non-small cell lung cancer cells, which is one type and the commonest form of lung cancer, and also a very severe form of brain cancer called glioblastoma multiforme. If you yourself or you know anybody with those diagnoses, please inquire with us and talk to us about IV vitamin C therapy. Further, I am extremely pleased to announce that accepted for publication this year in 2017 was an article that I helped co-write. I'm a co-author with Dr. Heather Wright, who we've already mentioned on this episode. Dr. Wright and myself co-authored a publication on guidelines for the use of intravenous vitamin C therapy with 2 leading medical oncologists. Not sure on the timeline for the publication, but stay tuned and we'll be sure to let you know as soon as that's published. Stay tuned on our website. It's very exciting for us to have that accepted for publication after 2 years of effort. Diet and nutrition. What can I say? The human body likes certain types of food, and it doesn't like other types of food. And I'm not talking about necessarily just things that it likes because it tastes good. I'm talking about function and prevention of chronic disease, reduction of pain, improvement of sleep, improvement in concentration. Feeding the body the type of food that the human body should have is so important. And all of our physicians here are educated about diet and nutrition. Some of our physicians focus a little bit more on it, but we all can have discussions about diet and nutrition. And one of the exciting happenings here at Naturopathic Specialists, and certainly a subject that's been in the news, is the ketogenic diet. The ketogenic diet isn't only used from an oncology perspective, but many endurance athletes are turning to the ketogenic diet to help improve stamina and performance in endurance events and or even high-intensity training. So many of my patients have been put on this diet, have had questions about it, and at Naturopathic Specialists, we have a ketogenic diet program here. Ketogenic diet program should be medically monitored, we believe. Inquire with us if you have any questions about this, or if you've read about it in the news. In the world of oncology, the ketogenic diet program publication demonstrates that it's actually effective to help manage brain tumors. Women's health. Talk about women's health, because both Drs. Jessica Stefanski and Dr. Debbie Smolinski staff the women's health program here at Naturopathic Specialists. There's been quite a bit of publications in women's health, whether it be looking at natural treatments for menopause or pelvic pain or sleep disorders or mood issues. A lot of the research that's been demonstrated here has been shown about nutrient deficiencies as well. And the 2017 publications and work continues to move forward in the world of women's health. We have an excellent women's health department here, whether it be looking at somebody in adolescence looking to go gracefully into menarche, or a woman that is looking to gracefully transition from premenopausal through perimenopause into a menopausal state. Please give us a call if you have any questions about women's health or any of the women's health treatments that are offered here. Our physicians are experts at helping women with different complaints, and it really does take a physician focused in women's health to understand the unique complaints of women. One of the main things that we do here at Naturopathic Specialists when it comes to women's health is laboratory assessments. We are not quick to just throw hormones at a condition. We are very, very careful when it comes to hormonal balances in people. At Naturopathic Specialists, we do quite a bit of testing when it comes to looking at a woman's hormonal status, and we really believe in augmenting very safely and very responsibly. So if you're interested about how our women's health practitioners approach hormonal replacement therapy, or perhaps can treat your condition or your ailment without the use of hormone therapy very safely and effectively, please give us a call. Men's health. In the world of men's health, publication demonstrated that exercising while fasting created more fat burning in overweight men. Now, Be careful here. If somebody's overweight, you got to be careful. Number one, when you fast, because there's particulars that your physician would need to go over with you. Make sure that fasting is appropriate for you. This needs to be done via an exam and via testing and via a Q&A session too. And furthermore, if somebody's overweight, somebody may not be engaged in an exercise program. You got to be very careful how you start exercise programs when beginning one, especially if you're going to exercise and fast at the same time. Come talk to Dr. Waite. She can answer your questions. Furthermore, we just this month, something that's very interesting was shown that statins, certain statin drugs, have been linked to lower testosterone and sexual dysfunction in males. Again, if you think you are at risk for that, if you're on a long-term statin or somebody you know is on a long-term statin, give us a call. Come talk to one of our physicians about the use of statins, and we can question you, and we can also test your testosterone. That's a great recap for 2017. We certainly look forward to hearing from you this year and into next year. Please share your thoughts with us. What subjects would you like covered on Ad Hoc with the Doc? Please post if you would, since this is posted on Facebook. Share with us what you've seen, if there's been interesting articles, if you have questions. Give us a call, and we'll see you in 2018. Thank you.